I had asked whether there had been consultation with the local school boards, et cetera. I didn't hear an answer. I heard parents. I've heard from a lot of parents. And yes, people want the kids back in school, but they want it to be done safely. For school boards, I had asked, as soon as Senate File 2 was introduced, I contacted the 4 districts in my Senate district, and I hope each of you did. And right away, right to the superintendent and then to the boards. Do you support Senate File 2? No, no, no for all of them. And they talked about the need for resources. I asked, how has it been in terms of the working with the governor on the peacetime authority, on the executive orders put in? Has there been controversy? Yes, we're in a pandemic. We're trying to save lives. And staff, who has been heroic, has asked for protections. But their focus was on additional resources so they can get the job done. And again, on the question, Governor Walz, is he doing his job? Is this guidance for you? The answer was yes. And again, I pointed out, we have a variety of models that are in place in Minnesota based on local needs. There are guardrails, there's guidance to assist districts. And Mr. President, I realize that Senator Nelson does not have to yield, and perhaps I'll return with some additional questions, but I want to make some initial points. Regardless of who the governor is, he or she's authority to act during an emergency should not be revoked. That is not responsible. And legislators saw the need for doing that. I asked many school boards, do they support this? The answer was no. The Minnesota School Boards Association, do you support Senate File 2? No. And perhaps later we can go into some of the comments that they shared, concerns. Has there been controversy? Yes. All of our lives are disrupted. But you know what they're talking about? We need resources. You want to open the schools? Fine, give us resources. Teachers are concerned. I got an email late last night in District 622 from the teachers saying 250 have had vaccines, but there's 1,600 on staff. Do they have a right for expectation of being safe? I say yes. So to say open up, that's fine, but they need resources. The MSBA, I mentioned them. The same for the Association of Metropolitan School Districts. Both those groups include many parts of Minnesota. The rural education, rural school boards. Yes, you may find some members that oppose or support this, but the groups that speak up for them have said, don't revoke this needed authority. The Association of School Administrators, they actually did testify. There was time for them. Perhaps later I can go into the specific items. The bottom line was that this guidance is needed, and assuming you agree that it's good to have guidance, they also talked about the helpfulness in working and having the governor's authority in place. No one said to revoke it. And I've heard shaming by some of the teachers because they're concerned about safety and that we're blocking schools from opening, to be concerned about their safety and their families. Come on. There are a number of other groups. Healthcare professionals have weighed in. And by the way, the schools, they've been taking care of the children of a lot of these brave healthcare professionals, others in the front lines. They need additional resources, and they do not want us to revoke this emergency power. It's needed. We did have one person that I was really pleased when I saw for the committee that, hey, we're going to have a physician, and I believe she was ready to testify, and I was going to ask questions about, but then, and I was delighted that she was from Mayo Clinic, because I have the highest regard, and how proud I know you are, Senator Nelson, of that clinic. And I thought we could talk about how Mayo Clinic views the pandemic and emergency action. But the physician mentioned she was not there for Mayo Clinic and more of a parent perspective, and that's fine, and parents are frustrated, but I didn't see talk about revoking this as a responsible way to handle the emergency. I would have loved, actually, to have had testimony from Mayo Clinic from Dr. Gazelka. Yes, there was a Dr. Gazelka there.